Let's Talk About Kidneys takes a deep dive into the chronic kidney disease patient journey. We're here to inspire meaningful conversations and to help people living with CKD gain a full understanding of their disease. Tune in today to learn about the basics of sodium, what it is, how it relates to kidney disease, and how to make adjustments to your own sodium intake. Learn the importance of building a relationship with your dietitian to assist you with your journey. Well, I want to first say thank you so much, Carolyn Cochran, for being on our podcast today. I am super excited about today's topic because it's one that our listeners, our CKD patients, or even individuals that want to learn more about nutrition can learn from. So, how are you today?
Well, I think I'm doing great, Tiffany.
Good. So, I think we're going to jump right into it. What is sodium?
Well, sodium is essential for life. It's in animal, vegetable, mineral. It is important for muscle function, nerve function, and for fluid balance. And, you know, the first evidence of the use of salt goes back over 6,000 years BC. And that was found in different parts of the world where salt was used, primarily as a preservative.
So what types of salt contain sodium? Do they all contain sodium?
Well, there are so many types of salt used for cooking and seasoning. Of course, we all are familiar with table salt. There's kosher salt, sea salt, Celtic sea salt, fleur de sal, Himalayan pink salt, Himalayan black salt, red salt, black lava salt with charcoal of all things. And it is really confusing when you think of all these different types of salt. But the bottom line is that they all contain sodium. In a study done by the American Heart Association, they found that more than 60% of people who responded to their survey thought that sea salt was healthier than table salt.
Okay, so you're here to dispel that myth. So give us a quick, so of the salts that you mentioned, which is the healthiest?
Well, I consider them all equal.
Okay.
Because if you look at salt by weight, then they're almost identical. Now, the difference is in a fine grind versus a coarse grind, more of a rock salt. So if you're measuring by teaspoon or quarter teaspoon, more of a fine grind fits in the spoon than a rough grind. And you also have salt flakes. Many salts come in flakes,
okay,
which are very light. But if you measure them equally, the sodium content is comparable.
So does everyone need to decrease their sodium intake?
Well, everyone is an individual, so everyone is different. But I could say that almost every one of us consumes too much sodium.
So what about the people that actually need a high sodium diet? Can you touch on those individuals?
Well, this is a rather small percentage of the population. It would be people who have excessive sweat losses due to exercise. I'm thinking of football players and athletes. It could be someone who has a certain disease, very specific diseases that are salt losing. So in general, I think the majority of people would benefit from a low sodium diet.
Okay.
Mm-hmm.
Can you talk about the relationship between sodium and the kidneys?
Well, one of the jobs of the kidney is to keep sodium in balance. So if sodium is out of balance, your fluid balance in your body is also affected. The sodium level of your body affects muscle function,
Mm-hmm.
it affects nerve function, and it really is an essential nutrient.
Can you talk to us about how sodium affects high blood pressure?
Well, many people have a sensitivity to salt, and it actually is exhibited as, in high blood pressure. And high blood pressure, hypertension, is the number 2 cause of chronic kidney disease,
Yes.
or CKD,
Yes.
in the world, only second to diabetes.
Yes. What would be considered a low sodium diet?
Well, a low sodium diet is about 1,500 to 2,000 milligrams. For the U.S. population, 2,300 milligrams has been targeted as the healthy target.
Okay.
However, an average U.S. citizen will consume 3,500, 5,000,
Oh,
more than 5,000
wow. I could see
milligrams
that
of
happening.
sodium per day. Oh, especially people who eat out all the time.
I was just getting ready to say
Absolutely.
individuals that may grab a quick breakfast out, and then grab lunch with coworkers, and then, you know what, I don't feel like cooking dinner. So those of you that are listening that are eating out a lot, you may not want to do that as often because, you can't really measure the sodium content that these restaurants are cooking in. So that actually leads to my next question. How would a person track their daily intake of sodium?
Well, when it comes to restaurant and fast food meals, many of the larger or multiple restaurants or chains have their menus online with the nutrient analysis.
Yes, I've seen that. I've seen
Yeah,
that.
yeah.
Okay.
Now,
Um,
some people actually want to track their sodium intake. And for those people, I recommend that they start with a base of about 500 milligrams because there's sodium in food naturally. Sodium grows out of the ground. Sodium is in animals. It is just everywhere. So you've got to give credit to those first 500, maybe even 600 milligrams of sodium, and then you can start
that's so
counting.
interesting.
Right. And the reason I wanted to bring that up is that if you look online, you will see things like, oh, well, a teaspoon of salt has 2,000 milligrams of sodium, or more or less, and so I can use a teaspoon of salt every day. Well, the problem is you're going to have that teaspoon of salt and then there's no food.
Okay.
Yeah.
And so what you're describing is hidden sodium. Is that correct?
Right. Sodium that is not shaken on, right, or added during cooking that is added during cooking. It's just naturally occurring. You know what? I wish that everybody could see this because you know what I would like you to do? I would like you to take a salt shaker
Mhm.
and just close your eyes, and I would fold a piece of paper and put it under you, and you salt a plate of food, perhaps not the way you would salt it, because I
Right.
know how careful you are, Tiffany.
Yeah.
I mean, I've no doubt about that. But the way you've seen people salt food, that if you shake the shaker and then take that folded piece of paper and let all the salt fall into a quarter teaspoon and just see how much is it? Because a quarter teaspoon is almost 600 milligrams of sodium.
Wow.
Right. And people will say, well, I used to da 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 da
Mhm.
da, and now I just da da da.
Right.
Well, my goodness, they're still at, that sodium is just clicking up.
And you know what that gave me a vision of? Sometimes when I'm out, I see people shake the salt like in their hand and kind of pour it over. So maybe is that like a visual aid that people do, or is that just something I
Well,
noticed?
first of all, Tiffany, you said when they're eating out.
Mhm.
So there is a good chance that they're between 1,000 and 2,000 milligrams of sodium on the plate coming out of the kitchen.
Right.
So they're going to add another 500,
Yeah.
600.
I see it happen all the
Yeah,
time.
I'm just shocked.
Yeah. And
Yeah.
so we talked about eating out. So if people aren't eating out, there's a lot of convenience meals. Can you talk about the frozen meals that people are consuming?
Well, there is the need for convenience,
Mhm.
and I would be really ignoring reality if I didn't help people deal with having convenience. So my advice is to choose a frozen meal that is around 600 milligrams of sodium or less. So you remember we were talking about a daily sodium allowance of 1,500 to 1,000 milligrams per day being a good target. Well, if you had about 600 milligrams per meal, that gives you 1,800, and that's right in the middle. So say, for instance, if a person chose a frozen, like a bowl, and say it was 580 milligrams of sodium, and they got an almost sodium-free fruit to go with it, then, they still have 1,200 milligrams for the rest of the day.
That's that's so funny. That's a trick that I definitely use when I'm going throughout the day and eating. I'm like, okay, well, this didn't have that much sodium in it, and this does. So by the end of the day, I have to really balance that out. So those individuals that are listening, it is about balancing. It is about kind of taking each meal for its sodium content. So if a person were to give up salty foods and were never to add salt or include sodium in the meals that they cook, how would they season their food? How would they continue to be able to get that flavor that everybody wants?
Well, flavor is out there, and salt is simply not the only flavor. But I'm sure that you know people, just like I do, that if it's not salt and pepper, it's nothing.
Yeah.
I mean, like, what else is there? So if people are trying to add different spices and different seasonings to their cooking and to their meals, then they're going to have to be ready to know that they're in adjustment period. And for some people, that's only a couple of weeks, other people a month. I've known people that it took 2 months. And, the beginning of that, some people are not very happy about it.
Right. And how would a person, you talked about them transitioning where it can take a week, a couple of weeks, maybe even a month. How do people alter their own recipes? So say you got this recipe book that you've been, cooking for years, and someone meets with a nutritionist or a dietitianist and they say, hey, we got to cut the sodium. So how would a person alter their own recipes?
Well, first of all, I love that you said alter your own recipes because this is what people are used to eating. This is what they like to eat. This is what their grandmother cooked, what their, mother cooked, whoever was cooking.
Yes.
And this is what they want. So number one would be to just decide that the salt in this recipe can be cut in half this time and maybe cut down more next time. And maybe the third time you make it, the salt is gone.
Okay. All right.
Now, other ingredients could be salty in that recipe. One example might be canned chicken broth. So chicken broth or beef broth or vegetable broth comes in different levels of sodium. I'd like to talk about a food label. And so anyone who's ever looked at the food label knows that there's a lot of information on there. So if a person is looking at a food label, then the first thing that they're going to look at is at the top, and it is serving size.
Yes.
Now, this serving size is determined by the manufacturer. It's not the right size or the wrong size. It's simply the size that they chose.
In their content.
Right. And then you have to decide, are you going to eat this portion? Are you going to double it? Are you going to triple it? Because every number on that food label will have to be doubled or tripled to match. The sodium content is about in the middle, and it is in milligrams of sodium. Now, over to the right-hand side of every food label is a percent, and this is a percent of a recommended amount.
Right.
And it may not be what you are hoping to target. It may not be your percent. But certainly the milligrams of sodium would be very important if you were tracking or if you were looking for alternatives in your recipes. So in terms of chicken broth does come in multiple levels. It can be regular chicken broth that could be 800, 900 milligrams of sodium per cup. It could be reduced sodium, like 33% less sodium.
Okay.
And so that'll go down 500, 600. It can be unsalted chicken broth, which would bring it down into the hundreds.
Okay.
You see, the chicken broth itself still has some sodium naturally.
Right. So people need to distinguish which level. And I do know that in the stores, the labels that have a lesser amount of sodium, the label kind of stands out. So I think people can take away from this, not only reading the back of the food label, but sometimes some of the front, if you're using those canned sodium, you can see where it says 33% less sodium. That stands out. Am I correct in that?
Right. But I must say that a lot of times 33% less sodium is certainly not low sodium. Take, for instance, a canned soup. You know, one can of soup, a lot of people think of as a meal. But if you look at the portion size on the food label, one can makes 2.5 servings. So every number on that can is just a portion of that can. So if you ate the can of soup, it would, even if you added water, dilution doesn't matter, you would be getting...
Can you pause? That's interesting. So dilution doesn't matter. Talk about that.
Let's see, what kind of an example could I use for that? Say you had a dozen marbles and you put them in a glass and you decided to cover them with water. And there were your dozen marbles with water on them. And you jiggled them around and you just, were having fun with the colors. Then you decided to add more water and more water and more water. Well, you still have 12 marbles.
Right.
And if you're using that whole glass for your activity, then those 12 marbles have not changed. Only their distribution has changed.
That's so interesting. Everyone listening, take note, rewind that part, because I have family members and friends that have both said, oh, I'll just dilute, I'll just add more water, and I'm going to send them this podcast because that's not true. So we talked earlier about eating out and at restaurants and how they prepare the food. So if someone was listening and, eating out is something that people look forward to, it's a way to build relationships. A lot of people have meetings. What would you recommend individuals eat that are trying to watch their sodium and they're at a restaurant?
Well, first of all, be prepared. If you know you're going to a certain place, you can check out their menu, hopefully online. You could even call in advance and say, oh, my doctor is just really on to me about, following a low sodium diet. How can you help me? Do you think the cook could make my chicken and vegetables without salt? They may say yes, they may say no. But this is the kicker. And that is that even the cook might not realize that some of their mixed seasonings are heavily salted already.
Right.
Now some mixed seasonings are higher in sodium than others. Lemon pepper is mixed with salt, but it's not nearly as bad as some other seasoning salts. Now, speaking of choices, if you were counting sodium, then I would definitely recommend one of a couple of brands of lemon pepper that has no salt at all. If you look at the grocery store and look at your different options, take for example, Creole seasoning.
Yes.
Creole seasoning could be very, very salty, or it could be special recipe with no salt at all. And if you bring a magnifying glass, or for me, reading glasses, to the grocery store, you can look at the ingredients and see if these are all herbs and spices and no salt is listed, you got a good product, even if they didn't advertise that there was no sodium in their product. You can see that there's no salt.
Okay. And how about combining a low sodium diet with other nutrition that a person may need?
Well, a low sodium diet can be a base. And many people start with that base. And almost anything can be added to that. Say, for example, if a person has diabetes, they may be accustomed to managing their diet to manage their diabetes. They may be adding sodium control to that. So what they've been doing to manage their diabetes really doesn't change. They're just changing the seasonings that they're using to those that are acceptable and getting used to new flavors. Mm-hmm. Yeah, absolutely. Or even anyone who is mindful about their eating, sodium included, it can be helpful. Just thinking about food helps some people lose the weight they want to lose.
Okay. And so I know dietitians work closely with patients to individualize their needs. Can you talk about that dietitian-patient relationship?
Well, Tiffany, I think this is so essential because so many people are looking everywhere for nutrition information. And you can look online and find very credible appearing people that have absolutely opposite views on the same topic. So a dietitian in a consultation with a patient is going to collect information about their personal food preferences, their likes, their dislikes, any problems they may have, allergies, digestive issues, go through the medication list, discover if they're taking any vitamin or mineral supplements or herbal products that could be interfering with some other medications that they're taking, and they not even realize that that's happening. And the combination of getting to know the patient, listening to how they eat, how they get their food, lets the dietitian know how they might guide that person in discovering a way to change in the way that they want to change or choose to change.
Okay.
You know, the patient's goals, personal goals, are always number one.
Right. Okay. And so as we wrap this up, I wanted to see if there were 1 to 2 major things that you want to have the listeners leave here with after, listen to the first part of this podcast. What's a summary that you can give them?
Well, first of all, I want people to really respect salt. Salt is an amazing and wonderful element, and it can be used for so many things. But if your doctor has suggested that a lower sodium diet could be helpful in managing your particular issues, then inquire about medical nutrition therapy, because it might be that this referral for MNT will get you connected with a dietitian, like at Dallas Nephrology Associates. We have registered dietitian nutritionists who are experienced in renal disease and realize that every person is complex, and all of these things have to be taken into account.
All right. Well, I want to thank you once again for coming on and discussing this topic of sodium. Like you said in the beginning, it is all around us. It is rooted in the ground. It's in what we eat. It's how we prepare the food. So I think that this will be a super informative podcast that people can really gain some knowledge from. And you did such a wonderful job.
Oh, Tiffany, and so did you.
Thanks for tuning in today. Learn more about Dallas Nephrology Associates at www.dneph.com. That's DNEPH.com. And if you found the information valuable, be sure to share with those who are impacted by chronic kidney disease.
Dallas Nephrology Associates' DNA podcast series, Let's Talk About Kidneys, is provided for general information purposes only and does not replace the need to talk with a healthcare professional about your unique situation, care, and options. Our goal is to provide you with as much information as possible so you can be as informed as possible. Reference to any specific product, service, entity, or organization does not constitute an endorsement or recommendation by DNA. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity or organization they represent. The views and opinions expressed by DNA employees, contractors, or guests are their own and do not necessarily reflect the views of DNA or any of its representatives. Some of the resources identified in the podcast are links to other websites. These other websites may have differing privacy policies from those of DNA. Please be aware that the internet sites available through these links and the material that you may find there are not under the control of DNA. DNA shall have no responsibility for the accuracy, legality, or content of the external site or subsequent links. Contact the external site for answers to questions regarding its content. The resources included or referenced in the podcast and on the website are provided simply as a service. DNA does not recommend, approve, or endorse any of the content on the linked sites. The content provided on this website and in the podcast is not medical advice and should not be used to evaluate, diagnose, treat, or correct any medical condition. The content is solely intended to educate users regarding chronic kidney disease, end-stage renal disease, ESRD, end-stage kidney disease, ESKD, and related conditions, and ESRD, ESKD treatment options. None of the information provided on this website or referenced in the podcast is substitute for contacting a healthcare professional.